Feature Site, back again with Dr. Pierre Belanger.
In the field of
health monitoring and drugs.
Yeah. If you take, for example, a certain type of drug with a pharmaceutical company, this vest will allow you to capture all the information they need to know what is the side effect of that drug. The other possibility is that as patients go to hospital and they actually have a strong procedure or say an operation, doctors would like to actually release the patient earlier.
Future Sight, back here with Dr. Pierre Belanger and the demo on ExoSkin, AstroSkin, and the app for acute care setting that could be taken home.
Yeah. So one of the application of the technology we're developing is to be able to have patient early release from the hospital after surgery or after trauma, and being able to still be monitored at home as if they were in emergency ward. And the idea is that we take the sensing data that is provided by the vest, and then we ship that to the cloud, and this information gets displayed to the surgeon who's monitoring that person or the nurse, or it's been analyzed by our AI, which actually will give them warning when there are actually bad conditions associated to their patient.
So this is remote monitoring at home?
So remote monitoring at home for acute care patient or for older people, patient who have, let's say, very frail condition.
So for example, long-term care homes.
Long-term care home.
Or even palliative care.
Exactly.
So that if you had a loved one and you wanted to sort of keep track of what's happening, that you could.
Absolutely. That's right.
That's quite amazing. So what happens to the heart rate here, if you want to bring that
yes, I can show you. It's the same idea. Oops, sorry. We basically have, of course, in this case here, we have no motion. So what we have is basically very nice measurements that you can easily analyze from the vest. And then, of course, we have the other measurements, which in this case here are breathing. So, for example, COPD patient, we can actually analyze their breathing as associated with the heart. And we can also determine if the person is having convulsion, for example. So a lot of those patterns can be analyzed by our AI and then transmitted. So what the doctor receives is not just those signals, because you can imagine if you have 100 patients, you will not be able to monitor that. But on the other hand, if your AI can easily analyze 100 of those signals and then give, if you like, the medical explanation for those signals.
Okay, that's excellent. So what happens to his heart rate when Hongzhu sits up?
Up.
Hongzhu, do you want to sit up? Yeah.
Again, sorry to read.
So you can see it in motion.
In motion, yeah, that's right. So but with our algorithm, we can actually compensate for that using the accelerometer. So.
Excellent. Thank you very much. Look forward to the next episode.